There's a small bottle on my kitchen counter. It's been there for years in one form or another, sometimes a different brand, sometimes a different shape, sometimes a slightly different name I could barely pronounce, but always the same quiet promise printed on the label: fast relief. For most of my life, I never gave that bottle a second thought. None of us do. We reach for it the way we reach for a glass of water, without ceremony, without fear, without the slightest suspicion that something so ordinary, so easy to buy, so cheap that we hardly notice the cost, could ever be turning against us. We keep it next to the coffee, next to the car keys, in the drawer by the bed, in the bag we carry to work. It blends into the furniture of our lives, and that, I've come to understand after a long time of looking closely, is exactly where the danger begins. I want to tell you what I learned because I think it matters more than almost anything else I could share with you, especially if you're past 60 or if you love someone who is. I spent a long time reading, listening to cardiologists, going through studies, sitting with the kind of careful, patient explanations that doctors rarely have time to give in a 10-minute appointment, trying to understand something that had quietly puzzled me for years. Why so many people who seemed careful with their health, who watched what they ate and walked every morning, who gave up the cigarettes decades ago and kept their weight in check, still ended up in an emergency room with a heart that had failed them without warning? These were not careless people. They were the cautious ones, the responsible ones, the ones who thought they had done everything right. And the answer, in more cases than I ever expected, was sitting in the medicine cabinet the whole time, in plain sight, asked to do a small and innocent job and quietly doing something else entirely. Let me start where it really starts, with how safe these pills feel. Think about it for a moment, honestly. You don't need a prescription. You don't need a doctor's signature. You don't need to explain yourself to anyone. You walk into any pharmacy, any supermarket, any corner store, any gas station on a long drive, and there they are on the shelf, lined up beside the vitamins and the cough drops and the candy at the checkout, as casual as a pack of gum. There are no locked cabinets, no warnings shouted at you, no pharmacist pulling you aside to ask if you're sure, no form to sign, no questions about your age or your heart or the other medicines you take. The message we absorb without anyone ever saying it out loud is simple and powerful. If it were truly dangerous, they wouldn't let me just pick it up and buy it. Surely someone somewhere would stop me, and so we trust it. We trust it completely, and we pass that trust down to our parents and our children without ever once examining it. That trust is the most dangerous part of this whole story, because the back pain comes, and after a certain age, it always comes. The knees ache when you climb the stairs, the shoulders stiffen in the cold, the headaches arrive more often than they used to, and they stay longer. The hands, the hips, the lower back, the joints that carried you faithfully for decades start to complain, first in a whisper and then in a voice you can't ignore. And so you take a pill, one in the morning, maybe one at night. It helps. The pain softens. The edges of the day become bearable, and you go on living. You garden. You play with the grandchildren. You sleep through the night. Then you do it again the next day, because the pain came back, and the next, and the day after that, and slowly, without ever sitting down and deciding to, you've turned a once-in-a-while remedy into a daily companion. Months pass, years pass. The bottle gets refilled so many times that you stop noticing the refills, the way you stop noticing the sound of your own refrigerator. And the whole time you feel completely fine about it because nothing on that label ever frightened you and nothing in your body ever warned you. I understand that completely. I did the same thing for longer than I'd like to admit. My mother did the same thing every day for her back for as long as I can remember. Almost everyone I know over the age of 60 has done the same thing. We were never reckless people. We were just people in pain who found something that worked, sold to us as harmless, recommended by friends and neighbors, and sometimes even handed to us by people who loved us, and we used it the only way it made sense to use it, whenever it hurt. The cruel irony, the thing I keep turning over in my mind, is that it's precisely because these medicines seem so innocent that they become so dangerous. Nobody monitors something they don't fear. Nobody questions a pill they've taken 1,000 times without harm. Nobody writes it down on the list they bring to the doctor because in their mind it isn't really a medication at all. It's just the thing you take for pain. The threat hides not in some exotic drug with a frightening name and a long list of warnings, but in the most familiar little tablet on the shelf, the one you'd never ever think to suspect, the one sitting in your hand right now. So let me explain what's actually happening inside the body, because once you truly understand the mechanism, once you can picture it, you will never look at that bottle the same way again. And I promise to keep this clear and simple, the way I wish someone had explained it to me years ago, with no jargon and nothing to memorize, just a picture you can hold in your mind. Here is the truth that changes everything. The body at 60 is not the body at 30. We know this in our bones. We feel it every single morning, in the first few steps out of bed. But we rarely stop to think about what it actually means on the inside, deep in the places we can't see, at the level of the heart and the blood vessels and the kidneys. When you're young, your arteries are soft and flexible, like a fresh garden hose left out in the summer sun. They stretch and rebound with every single heartbeat, expanding to absorb the pressure and then springing back, keeping the flow smooth and even. Your kidneys filter your blood with effortless, tireless efficiency, sweeping out the excess salt and the extra fluid without you ever noticing they're working at all. Your heart pumps against gentle, forgiving resistance, like pushing a swing that wants to move. The whole system has enormous reserve, enormous spare capacity, enormous room to absorb a shock and recover from it as if nothing had happened. But as the decades pass, that margin quietly, invisibly shrinks. The arteries grow stiffer and less elastic, less like a soft hose and more like an old pipe that has hardened in the wall. They simply don't flex the way they used to, and they don't spring back. The kidneys slow down. They filter less with each passing year. They clear less. They hold on to more of what they used to flush away. The heart works against higher resistance, pushing a little harder for the same result, and the blood pressure becomes far more sensitive, far more reactive to anything that pushes on it from the outside. None of this is a disease. Let me say that clearly because it matters. This is not illness. It's simply aging. The normal, universal, unavoidable aging of the cardiovascular system that happens to every one of us, the fittest athlete and the gentlest grandmother alike. But it means one thing that matters enormously. After 60, the body has far less cushion than it once did. Things that the young body would shrug off and forget by lunchtime, the older body cannot. A small interference that meant absolutely nothing at 30 can tip the entire balance at 65. The same push lands on a system that has far less room to give, and this is where those common painkillers walk straight into the danger zone. Most of the ones we reach for belong to a single family of medicines called NSAIDs, non-steroidal anti-inflammatory drugs. Don't worry about the name, just remember the family, because nearly everything in your medicine cabinet for aches and pains belongs to it. They're genuinely brilliant at what they're designed to do. They block the specific chemical signals in the body that create the sensation of pain and the swelling of inflammation, and the relief they bring is real and immediate and deserved. I'm not here to tell you they don't work. They work beautifully. But here's the part nobody puts on the label in plain language. Those same chemical signals they block do other jobs in the body too. Quiet, essential, behind-the-scenes jobs that keep your pressure steady and your kidneys flowing and your blood in balance. And when you block them day after day after day, you disturb a delicate balance you can't see and can't feel. A balance that was holding many things in place at once. Let me walk you through it step by step, slowly, because this is the heart of everything I want you to understand. First, these drugs make your body hold on to salt and water. The kidneys, which normally flush out the excess sodium and the extra fluid like a faithful drain, start retaining it instead, holding it back inside you. That extra retained fluid increases the total volume of blood pushing through your vessels. And here is the simple physics of it. More volume inside a closed system means higher pressure against the walls. Picture a garden hose with the nozzle half closed and the water turned up. The pressure has nowhere to go, so it climbs. So your blood pressure creeps upward, maybe just a few points at first, maybe more over time. And here is the cruel twist for the millions of people who already have high blood pressure and take medicine to control it. These painkillers can directly blunt and weaken the very pills you take every morning to keep your pressure down, quietly canceling out part of your treatment without you ever knowing it's happening. You take your blood pressure pill faithfully, and you take your pain pill faithfully, and the second one is undermining the first. Second, that rising pressure falls on arteries that are already stiffer and more rigid with age. A young, flexible vessel can absorb a surge in pressure, the way a good shock absorber soaks up a bump in the road. An older, hardened one cannot. It has lost that give, so it transmits that pressure straight through, undiluted, to the delicate inner lining of the vessels and onward to the heart itself. The heart now has to push harder against that resistance with every single beat, hour after hour, day after day, year after year, without a single moment of rest. That extra workload, repeated tens of thousands of times a day and millions of times a year, slowly wears the heart muscle down and causes its walls to thicken and stiffen in ways that are not healthy and not reversible by wishing. The heart, like any muscle forced to strain constantly, changes, and not for the better. Third, the kidneys again, because they sit at the center of all of this. They were already filtering more slowly with age, already working with a narrower margin, and now these drugs reduce the blood flow reaching them even further, choking back the very supply they need to do their job. And here is something most people never learn. The kidneys and the heart are partners, bound together so tightly that they rise and fall as one. When one of them struggles, the other suffers for it, almost immediately. Strained kidneys hold on to even more fluid, which raises the pressure even more, which strains the laboring heart even more, which weakens the flow to the kidneys even more. It becomes a quiet, vicious circle, a wheel turning silently in the dark for months and years, each part dragging the others down, and you feel none of it turning. And fourth, this is the one that turns a slow, grinding problem into a sudden catastrophe in a single moment. These medicines can shift the delicate balance that governs how your blood clots. The body is always managing a fine line between bleeding too easily and clotting too easily, and these drugs can tip that line toward clotting, making the blood more prone to forming a clot inside a vessel that is already narrowed, stiffened, and roughened by the years. And a clot is the trigger. A clot is the match that lights everything that has been stacking up. A clot that lodges in an artery feeding the heart muscle is a heart attack. A clot that blocks an artery feeding the brain is a stroke. All of it, the retained fluid, the climbing pressure, the overworked and thickened heart, the strained and starving kidneys, the stiffened vessels, the readiness to clot, all of it stacks up, layer upon silent layer, like snow building on a roof, until the system that protected you faithfully for a lifetime finally reaches the point where it can no longer hold, and it gives way all at once. That's the part that genuinely haunts me, the part I most want you to feel. There's no alarm, no siren goes off the day your pressure ticks upward, no light blinks, no pain announces that the balance has shifted. You feel completely, perfectly normal taking that pill for your sore knee or your aching back. There is no warning sign, nothing to tell you that something invisible is being pushed slowly, patiently toward an edge. The snow keeps falling on the roof and the roof makes no sound. And then one ordinary day, getting up from a chair, carrying the groceries in from the car, bending to tie a shoe, sitting down quietly to dinner with the people you love, the edge arrives, all at once, with no negotiation and no second chance. Now, before I tell you exactly which 5 painkillers carry this risk, and I will name every single one of them clearly, with the brands you'll recognize, so there's absolutely no confusion, I want to stop and say something to you directly from the heart, because it would be wrong of me to leave you with the fear and not the path out of it. Understanding the risk is only half of the journey. It's the half that opens your eyes. But the other half, the half that actually protects you, is knowing what to do about it, what to actually change starting today. That's exactly why I've put together and left a complete guide in the first link in the description, a clear, practical guide on how to improve your blood pressure and build a stronger, healthier heart, made especially for people who are already past 60, written in the same plain language I'm using with you right now. It's nothing complicated, nothing overwhelming, nothing that asks you to turn your life upside down. It's the exact natural continuation of everything you're learning in this very moment, the what do I do now, that follows the what is happening. So before you go any further, take a moment and glance down at that first link in the description. It's there for you, and it's truly worth the quiet few minutes it takes to read. Now let me take you deeper, because the question that matters most is not just what happens inside the body, but why age itself is the thing that turns an ordinary trusted medicine into a silent threat. Why can a younger person take the very same pill for years and seem to walk away unharmed, while the very same habit after 60 becomes a genuine danger? It's the same tablet, the same dose, the same shelf. What changed? The answer comes back to that shrinking margin I described, the disappearing cushion. A 30-year-old has so much reserve built into the heart, the kidneys, the blood vessels, that a small disturbance gets quietly absorbed and simply disappears without a trace. The young kidney effortlessly filters out the extra fluid before it can ever build up. The young artery flexes around the extra pressure and springs back as if nothing happened. The young heart barely registers the extra work. It has power to spare. There's so much cushion, so much spare capacity, that the harm never once reaches the surface where you could feel it or measure it. But after 60, that cushion is mostly spent, used up slowly over a lifetime of faithful service. The very same small disturbance now has nothing to soften it, nothing to absorb it, nowhere to be quietly tucked away. The pressure has nowhere to go but up. The fluid has nowhere to go but in. The heart has no spare capacity left to give. The very thing that made these drugs feel so safe for so much of your life, your body's deep, hidden, generous resilience, is precisely the thing that quietly faded with the years, and now the drug arrives to meet a system with no reserve left to protect you. The medicine didn't change at all. You did. We all do. That's not a failure, and it's not a fault, and it's nothing to be ashamed of. It's simply, plainly what it means to grow older, and it's exactly why the rules we live by have to change as we change. I think often about the people who learn this lesson too late, because they are real, and there are so many of them. The man who took his anti-inflammatory every single day for his bad back for 15 years, never once giving it a thought, never mentioning it to a single doctor, until the afternoon his chest tightened in a way he'd never felt, and his whole life split cleanly into a before and an after. The woman whose ordinary routine checkup turned without warning into a frightening, serious conversation about her kidneys and her heart, and who sat there in that chair, stunned, asking herself over and over how on earth this could have happened when she had done nothing that she ever thought was wrong. The quiet, heavy regret in a voice that says, if only someone had told me, I would have asked, I would have done it differently, I would have been more careful, I just didn't know. I don't share these stories to frighten you or to fill you with dread. I share them because every one of them was preventable, and because you, right now, still have the one thing that those people would have given anything to have back: time and the chance to know before it's too late to use the knowing. Because that, in the end, is the entire point of what I'm telling you. The goal was never to scare you into a corner. The goal is to inform you fully so that you can protect yourself wisely. Knowing this risk, really understanding it, is precisely the thing that gives you the power to walk into your doctor's office, standing a little taller, and have a real, honest, productive conversation, to ask the questions that actually matter, to look at your own list of medicines with new and clearer eyes, to make better choices alongside someone who knows your body and your history. Information like this doesn't replace your doctor, and it was never meant to. It does something better. It opens the door to a far better conversation with them, the kind of conversation that only happens when the patient walks in already knowing what to ask. And let me be absolutely, completely clear about something, because it is vital, and I don't want a single person to misunderstand me. You should never, ever stop taking any medication on your own, abruptly, because of something you learned in a video, including this one, including everything I've just told you. Some people take certain medicines, even some on this very list, under careful and deliberate medical guidance for very good and very important reasons, and stopping suddenly and without supervision can be a danger all its own, sometimes a worse danger than the one you were trying to avoid. What this knowledge gives you is not permission to act alone, it is a reason to ask, to bring it up, to sit across from your doctor and say, in plain words, I've been taking this often, maybe more often than I realized. Is it right for me, at my age, with my heart, with everything else I take? That single question, asked out loud in the right room, can quietly change the entire course of your life. So now, with all of that fully understood, the mechanism, the aging, the danger, and the path through it, let me give you what the title promised. Let me name them one by one clearly and without hedging. The 5 common painkillers that, taken often and over time after the age of 60, are linked in study after study to a higher risk of heart attack and stroke. I'll say each one plainly with the brand names you'll actually recognize on the shelf and in your own cabinet, and with each one I'll remind you exactly why it belongs on this list, tying it right back to everything we've just learned together, so it's never just a name to you, but a thing you truly understand. The first is ibuprofen, the one you'll find sold under brands like Advil and Motrin, and under the store's own generic label, too. It's almost certainly in your home right now. It's in nearly every home. It's one of the most widely used pain relievers in the entire world, taken by hundreds of millions of people, and it is a classic, textbook NSAID. With frequent ongoing day-after-day use, it can raise your blood pressure, push your body to retain fluid, and strain the kidneys, the exact chain of events, link by link, that we just walked through, the chain that pushes an aging heart steadily toward trouble. The very fact that it's so common, so trusted, so casually taken, is what makes it so easy to overuse without a second thought. The second is naproxen, found in brands like Aleve, and again in many generic versions. People often reach for this one specifically because each dose lasts longer, which sounds like a convenience and in some ways is, but it also means the drug stays in your body longer, exerting its effects over more hours of the day and night. It carries that very same NSAID burden we discussed, more fluid retention, more pressure on the kidneys, more workload on the heart. The convenience of swallowing fewer pills a day can quietly translate into a more constant, more sustained strain on a system that needs rest, not steady pressure. Longer-lasting relief can mean longer-lasting interference. The third is diclofenac, sold under names like Voltaren, and found not only in pills, but also in those creams and gels that so many people rub directly onto an aching knee, a sore shoulder, a stiff hand, thinking that because it goes on the skin, it must be gentler and safer. This one deserves your special attention, so listen closely. In study after study after study, diclofenac has stood out as one of the NSAIDs most strongly and most consistently associated with cardiovascular risk, among the worst of the family for the heart. And here is what surprises people most. Even something that feels as harmless and as local as a gel for your knee is still part of this same chemical family, still absorbed into the body, still working by the very same mechanism we've been discussing this whole time. The form changes. The danger does not vanish with it. The fourth is celecoxib, known by the brand name Celebrex. This one belongs to a slightly different subgroup of the family called COX-2 inhibitors, and it is often prescribed precisely because it tends to be gentler on the stomach, causing fewer ulcers and less bleeding in the gut than the older drugs. That's a genuine benefit, and it's why many people are switched to it. But please hear this clearly, because it's where people are most often misled. Gentler on the stomach does not mean gentler on the heart. Those are two entirely different organs facing two entirely different risks. With prolonged regular use, celecoxib still carries real and serious cardiovascular risk. The same pressure on the same system, the same strain we've been talking about from the very beginning. A kinder stomach does not buy you a safer heart. And the fifth is aspirin, but here I have to stop and draw a very important distinction, more carefully than with any of the others. I mean aspirin used in high doses, or used carelessly and casually without medical guidance. Here, I have to be especially precise, because aspirin is genuinely, truly different from the rest, and I would never want to frighten the wrong person away from something that is helping them. In specific situations, after a heart attack or a stroke or for certain high-risk patients, a doctor may deliberately prescribe a low daily dose of aspirin precisely to protect the heart and prevent clots. And for those particular people, taken exactly as their doctor directed, it can be exactly the right thing, even a life-saving thing. So if that is you, do not stop. The real danger lies in using aspirin on your own, unsupervised, taking high doses for everyday aches, or worst of all, combining it with one of the other NSAIDs from this very list, doubling up without realizing what you're doing. That combination sharply raises the risk of dangerous internal bleeding and other serious complications. Aspirin is the clearest example in all of medicine of why the message can never be a simple good or bad, but must always be the right amount for the right person with the right guidance. Do you see now how every single one of these connects back to everything we built together piece by piece? It isn't 5 random, frightening names thrown onto a list to alarm you. It's the logical, inevitable conclusion of the whole story. 5 medicines that, through fluid retention, rising blood pressure, strained kidneys, stiffened vessels, and a greater tendency to form clots, can push an aging cardiovascular system past the very edge it no longer has the reserve to defend. And let me say this as plainly and as fairly as I possibly can, because I refuse to be misunderstood on it. The point of all this is not to demonize these medicines or to tell you they are evil. They are not. They relieve real, daily, grinding suffering, and for countless people in real pain, they are a genuine gift, a mercy, a way to keep living fully. The point, the only point, is that after 60, they demand respect. They demand care, medical guidance, honesty, and moderation. The very same pill that helps you so kindly on a Tuesday, taken thoughtlessly and automatically every single day for a year, for 2 years, for 10, can quietly become something else entirely while your back is turned. So what do you actually do with all of this now that you know? You don't panic. Let me say that first and clearly. You don't run to the kitchen and throw out your entire medicine cabinet in a wave of fear. That helps no one, and panic is just another way of not thinking clearly. Instead, you become informed, calm, and active in protecting your own heart. You start reading the labels, really reading them, and you finally notice which family your pills actually belong to, perhaps for the first time in your life. You take an honest, unflinching look at how often you've truly been reaching for them, not the comfortable story you tell yourself, but the real number. And then you bring all of it, every bottle, every gel, every habit, written down if you need to your doctor, and you ask the questions you now know exactly how to ask. You explore together whether there are safer ways to manage your particular pain, whether there's a lower dose that would still help, a different kind of medicine, a non-drug approach, a physical therapy, a better path forward for a heart that has earned some extra care after all these years. And now that you know the 5 painkillers and exactly what they can do, let me give you the most important next step, the way I'd tell it to someone I love sitting right across the table from me. Knowing the danger is good, and you should be proud that you stayed to learn it. But knowing the danger is only the beginning. Actively, deliberately caring for your heart is the thing that truly changes your future and the number of good years still ahead of you. As I mentioned earlier, I've left that complete guide in the first link in the description. The practical, plain-spoken guide on how to improve your blood pressure and build a healthier, stronger heart, made for exactly the stage of life you're in. Please take a look at it today, not someday, not next week when you have more time, because someday has a way of never arriving.